Got an agenda in front of you. Number one is to discuss the percentage increase in millage rate over the rolled back rate. At the July 17th, 2025 regular monthly meeting of the hospital district, the trustees approved a tentative budget for fiscal year 25-26, which maintained the current year's millage rate of 0.7650. This millage rate represents an increase of 6.71% as a percentage of the rolled back rate and will provide the hospital district with ad valorem tax revenue of $24,372,463. This is an increase in ad valorem tax revenue of $1,967,025. The increase in tax revenue is due to the increase in the assessed property values in the county. Item 2, discuss specific purposes for which ad valorem tax revenues are being increased. There are many factors which directly impact the work of the hospital district and the healthcare supports that the district provides to Indian River County citizens. Some of these factors are: our county's population continues to grow, directly impacting the demand for healthcare services. The ever-increasing costs of healthcare, including the cost of medical supplies, staffing, and facilities, is significant, and some projections suggest double-digit increases in healthcare costs for 2026. If realized, those increases would make next year the highest single-year increase in more than 10 years. I will also point out, as I did last year, that inflation has had a big impact on all of the community partners that the district funds and on the administrative costs of the district itself. Also, Medicaid coverage is declining in Indian River County. Medicaid coverage for many in the last year or so through the Medicaid redetermination process were directly impacted, and that impacted approximately 10,000 Indian River County residents. The district plays a critical role in improving and enhancing community health by providing care to our county's vulnerable populations. Many in our county are underinsured or non-insured, and it's the district's mission to assist all in need. Investing in primary and preventative care is a proactive approach that can reduce the need for more expensive emergency care at a later date. Additionally, you may be aware that the hospital district is in the process of evaluating the attitudes, opinions, and levels of awareness of county residents regarding the availability of maternity health care services for all county residents. That includes prenatal, labor and delivery, and postpartum services. These evaluations and discussions will assist the district in our strategic planning and possible enhanced funding for the long-term availability of these important services. Please know that each and every trustee, as well as the district staff, are dedicated to be good stewards of the public's money. We're committed to the mission and vision of the district, and we take our fiduciary responsibilities on behalf of the citizenry very seriously. I also wanted to note that the district's process of reviewing funding applications was enhanced this year and included an analysis on how closely the programs that we fund align specifically with the district's mission and goals. The redesign has led to sunsetting funding for several programs over the next year. These decisions were not easy, as all of these programs provide important services. And all of the trustees were involved in serious deliberations and about levels of alignment and of funding. I'll also note that the RFP funding requests for next year's budget totaled $20.5 million, and the trustees' deliberations decreased the awarded funding by $2.1 million down to $18.4 million. We believe this proposed budget is appropriate and will allow the district to keep pace with rising costs, the support of important and impactful healthcare agencies and programs, and to maintain the quality of care that all of our residents expect and deserve. Lastly, I do want to note that the trustees will address a few outstanding budget items at our chairman's meeting on September 17th, which might modify the total budget for next fiscal year. And additionally, it's likely that there will be some discussion about the proposed millage rate for next fiscal year. However, I want to make it very clear, should there be a change in the millage rate, it can only be lowered. It cannot be raised by state statute. Our final public budget hearing, where the final approval will be given to next year's budget and the millage rate, will be held at 5:01 p.m. on Thursday, September 18th, just prior to the district's regular monthly meeting, and that meeting will be here in these chambers. Item number 3 is to listen to comments and field questions. First, I will ask if there are comments from any of the trustees. Alan.
Thank you, Mr. Treasurer. Thank you, Michael. I hope you find these comments constructive and illuminating for how we, at least I, am looking at the budget. I'm going to vote for a flat millage that's already been approved and thus far in the budgeting process of 0.7650 is the same as the current fiscal year. However, because property values have appreciated, as Michael pointed out, this represents an increase in actual dollars spent. It's important to note, however, at least by my calculations, the actual millage recommended on an apple-to-apples basis is a little lower than 0.7650, like 0.7350, or about 4% lower. However, as Michael pointed out, we're dealing with a new element in our considerations, the sustainability of labor and delivery. So as a trustee, I can only speak for myself, but I believe that we are in agreement that the district, working with Cleveland Clinic Indian River Hospital, assures the public that we will have labor and delivery available in Indian River County for the foreseeable future for mothers that prefer to have such services in the county. Now, it's been pointed out at various public meetings that labor and delivery services are uneconomical. The principal reason for this is inadequate Medicaid reimbursement to service providers. This is a national fact, but it's more acute in Florida, where Medicaid is estimated to pay less than 60% of actual costs. Actually, by my estimate, it's much worse than that, with total reimbursement including prenatal care and postpartum care, not to mention labor and delivery, is about $3,200, according to the Hospital Care Cost Institute from Medicaid. But the average by insurance, private insurance, is $7,500. So that sounds more like 40% of the costs than 60. Now, this is what Cleveland Clinic is dealing with. And annually, about half of our births in the county are Medicaid eligible. So the solution to reach the economies of scale by consolidating care significant distance from our residents' homes, or we can support these services locally in some other way. In my view, that's the best reason we have a hospital district, to deal with local problems locally and not be dependent on the federal government or even the state government. Our town halls revealed a compelling majority of our residents want this service in our county. And we're going to spend the next year figuring out how to figure out the most efficient and most effective way of providing these services. So taxpayers should realize the only reason this year's millage is even the same as last year's millage is to address the labor and delivery issue without having to exhaust our reserves. Otherwise, the millage the trustees have recommended would have been down. So I just wanted to make that comment.
Thank you, Alan, very much. Comments from any other trustees?
Yes, thank you, Trustee Jones, for those comments. I support what you said, and I look forward to our discussions on the 17th and the 18th. I believe, looking at the tentative budget, that it is still possible to lower the millage rate a little bit and still adequately provide for maternity care and to have adequate reserves. And I commend Trustee Kent for the outstanding job he's done helping to put together this tentative budget. But as you said, I don't think there would be any way that we could reasonably support maternity care without a significant expense of dollars.
Yes, I would comment as well. I think that first of all, the budgeting process has been excellent. Michael, you've done a wonderful job in consolidating all the different views. I think tax paying related to the maternity issue is just one component of a community-wide effort that will be needed to step up and maintain those services within our county as they currently are presented. And as Alan mentioned, it's so difficult with Medicaid decreasing as it is to provide, particular to our Alice population, other indigent people, the type of care that they need and deserve. And I think that's what our goal is, to maintain excellence in healthcare within our community. I think we're striving very hard to do that.
Kate, do we have any of the other trustees on line? I don't know.
Yes. Yeah, hello. So I apologize. I had intended to be there, but I've got a very dear family who's going through a really serious medical issue, and I'm in Orlando with them. So I'm sorry I'm not there, and I'm sorry for my appearance. But just briefly, I'm hopeful that we can have a serious discussion regarding what's really necessary for the reserves. I apologize for the background noise. I'm in the lobby of a hospital, which I want to focus on, be our primary focus at our upcoming chairman's meeting. I believe that Dr. Rothman did us a really nice favor at the last time he spoke with us in terms of giving us sort of a benchmark of the range that he would be looking for from us. And I think if we process that number together with what our finance committee has told us is an adequate reserve, which would put roughly $3 million, 3 months worth of reserves at 4.5, together with the range that he wants. If we were to lower our reserves to the 8 million to 8.5 million, I think that would still give us a very safe cushion, keeping in mind that the big beautiful bill doesn't come into effect until after January 1 of 2027. So we're not going to see that during this coming fiscal year that we're going to be planning for. I'd be much more comfortable having us reserve and plan for that in an informed way, in a way that considers some of our other partners in the community that we work with, so that we have a strategy that takes into account exactly how it's going to impact us. Because a lot of what's in that program unfolds over time anyway. You know, and I played around with some of the numbers, and just at the new minimum wage of $14, every $1 million that we keep in our bank account in order to fund reserves, thus causing us to tax more. You know, in other words, if we use our reserves to cover some of these items that are currently in our budget, it's that much less that we're going to tax. Every million equates to about 71,000 work hours. There's a trade-off in our community. We're asking them to give up their man hours, in a sense, to have us have a reserve that we're supporting that I believe is more than we need. Our reserves really is our budget. You know, we plan for providing fee for services over time. And it's not as though we have a physical plant that requires, uh, the maintenance of roads and bridges and things of that nature. There's very little capital that we support for purposes of having a reserve. Most of our reserves are if there's a specific need. Our financial experiences, even during the height of COVID, were, as I read the data, we were able to add to the reserves during that season. So at our coming meeting, my expectation is for us to really have a hard look at the reserves and determine whether or not we really need to do that. I just would anticipate our reserves could be 0.6950 if our reserves are at, our millage would be 6.950. If our reserves were set at 8 million, 8.5, it's 0.712. Again, I would really want us to take a hard look and determine really what we need. And in the coming year, do some serious planning regarding the big, beautiful bill. I think that puts us in a better position to be better stewards and to better communicate to the community why we're taking that money in order to meet the needs that are rising from what has been developed or as a result of our planning in order to deal with what may or may not occur with the big, beautiful bill. So more to talk about when we get together in a couple of weeks, and I appreciate your time.
Thank you. Is Karen? No. Okay. Listen, I thank you all, and Michael will say that he agrees a little bit with everything that was said here. I think we're going to have a very robust discussion at the chairman's meeting. I think there are some elements that we can drill down on and get into. So with that, I will turn to the public, both online or here in the chambers, if you have any comments to make. Anyone online, Kate? All right, with that, we will actually skip number 4 as we're not making any changes based on comments. Or 5, recalculating a new millage rate, which gets us to the ultimate action here. In number 5, we have to adopt the tentative millage rate. Again, it has been set at 0.765, and I need a motion to accept that rate from one of you.
So moved.
Moved by,
Second?
thank you. And I'll ask now for any trustee discussion. Public comment on the millage? Call the question, the voice vote. Chuck? Mike says aye.
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 And I say aye, understanding, of course, that we're going to have a nice discussion in a couple of weeks.
Correct. Thank you, Paul. The second item is to adopt the tentative budget. And the most recent, you saw this, is for $24,372,463. Need a motion to accept the tentative budget at that amount?
So moved.
And a second? Trustee discussion on the point.
I have a question, Michael. Included in your report is the tentative budget. For procedure, maybe Frank can answer it. Others, is this published and open on our website and in other areas for all interested parties?
Yeah, I can answer that, Dr. Cooney. Yes, we have a financial page on our website, and the tentative budget is posted now. It'll be updated with today's date, but I posted it, or Caitlin posted it rather, after our last chairman's meeting.
Thank you.
Any other discussion? Public comment? Voice vote, please. Michael says aye.
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 And Paul?
Aye. Aye.
The last item is to announce publicly again that the millage rate, 0.7650, as a percentage of the rolled back rate is 6.71%. at this point. And that concludes basically all of the items under the scheduled budget hearing, although there is a spot for generic public comment. There's not one there for trustees, so if the trustees have anything, I'm guessing that this would be the spot maybe for you to weigh in beyond what we've talked about. Hearing none, any public comment? I'll turn it back to the chairman, who I think can adjourn us.
Oh, thank you very much for a very in-depth report. And as I said, included with it is the detailed budget for those of interest. And no more other questions. The meeting is adjourned.
Thank you.